Louise Radnofsky is in Washington. She's a White House reporter for the Wall Street Journal. Louise, thanks for joining us.
Thank you for having me.
So the administration, as you know, has been criticizing the CBO, saying that they disagree strenuously with the report. Now that we have the numbers, what is the level of concern, you think, among Republicans that the score might damage the plan?
Well, there's obviously concern from centrist Republicans in particular over the coverage numbers that came out. The deficit numbers actually could alleviate some of the concerns raised by conservative Republicans, because the dilemma for Republican leaders is that they have to try and square a complicated circle with both wings of this party in a situation in which they can afford few defections. So right now, this may appease conservatives, but create new problems that leadership didn't necessarily have with some folks more in the middle of their party.
Yeah, we've heard reaction from the White House and House Speaker Paul Ryan. Ryan saying that he's encouraged by the report, while HHS Secretary Price saying the administration disagrees strenuously. As we continue to go through this reaction, strategically, there seems to be a different line of spin here going on. Is it more beneficial Republican leaders look to make changes in reaction to these numbers, or is it beneficial for them to continue discounting them?
Well, we heard a few different points from Secretary Price speaking outside of the White House earlier today. With OMB Director Mick Mulvaney, who made some of the same points that Paul Ryan did. They're encouraged by parts of the report that they believe are favorable. In Director Mulvaney's point, he likes the idea that premiums might go down over time. Speaker Ryan was talking about the potential for people to voluntarily drop coverage because, as CBO guessed, some people would no longer buy it if they didn't feel required to do so by the health law's individual mandate. Secretary Price was talking overall about doubting the coverage direction of the numbers that CBO put out. Everybody said that they'd be looking at it overnight. They were just commenting on the top lines, and they'll be coming back at it again tomorrow.
Well, over the weekend, we saw another key Republican knock the GOP's plan. Nevada Senator Dean Heller. Already more than a half dozen senators have criticized the bill, and Republicans can only afford to lose 2 votes. So where does this stand?
This is a really tricky one for Republicans. A lot of the concerns are coming down to Medicaid, because Republican states and as a result, Republican senators are particularly divided. Some of them expanded the program under the Affordable Care Act. Some of them didn't. Those that did expand the program under the Affordable Care Act, like Nevada, where Senator Heller is from, don't want to lose the funding that they got as a result of that. They would see millions of people, and now they've got a number from CBO to point to, losing coverage. States that didn't expand, citing concerns about cost, see themselves as having done the right thing in resisting a law that Republicans were sworn to oppose, and they don't want to be punished for doing what they think was the right thing and see people they believe do the wrong thing being rewarded for it. Again, another tough one to make the numbers add up on, because there's opposition on either side to doing what the other side wants.
So then do you think those complications could potentially prolong this process, or, more significantly, even kill the bill's chances altogether?
They could certainly prolong it. Our understanding is that Republican leaders hope to move fast, and that ultimately people will coalesce around this because they cannot afford not to do something they've said for 7 years they're going to do, repeal the Affordable Care Act. That said, we also don't think you're going to see a bill come to the floor until the votes are nearly there for it. So if you're not seeing the bill come to the floor, that's probably because leadership has some tough negotiating to be doing. We've written a little bit about the negotiating that's already been going on. We can only expect that to amp up over the next few weeks.
Meantime, I also want to ask you about health insurers who need certainty soon about what the individual markets will look like. Now, if they lose confidence as Republicans continue with their efforts, even more could potentially withdraw. What could that then mean for Obamacare customers' coverage?
That could be very difficult for people who currently have coverage in the individual market, both under the health law and through the exchanges, and outside of it, because they're all subject to the same pricing rules and they all draw on the same pool of insurers. There are a number of states right now, the administration makes this point, but it actually cuts both ways and is a potential risk to them as well. There are a number of states right now where there's only one insurer that serves people. Those insurers have enormous clout. The administration also relies on them very heavily to continue offering coverage through next year, when a lot of these changes are still going to be being rolled out, and beyond that. So the administration has had those insurers into the White House, has praised them. The president said that he recognized that these were big insurers, and privately and publicly they've been telling them they appreciate what they do. Publicly, the president also told the insurers to their face that if anything went wrong, he was going to blame them. So there's a little bit of a complicated relationship going on there. But what is in no doubt is that the administration knows it needs insurers very badly for this.
All right, Louise Radnofsky, thanks very much for your insight. Appreciate it.